Welcome to AI for Good, the leading action-oriented, global and inclusive United Nations platform on AI. Organized by ITU, in partnership with 40 UN sister organizations, and co-convened with Switzerland. The goal of AI for Good is to identify practical applications of AI to advance the United Nations Sustainable Development Goals and scale those solutions for global impact. In today's session, we're counting on you to use the live video wall feature to ask questions and post comments to help create an engaging discussion. We encourage you to stay until the end to chat, connect, ask questions, and network with our distinguished panelists and world-class AI experts in the neural network. It is now time to kick off the session and welcome our first speaker. The floor is yours.
Hello, everyone. Good morning, good afternoon, and good evening. Thank you for coming today to today's session. My name is Anna Green. I'm a postdoctoral fellow at Harvard Medical School. I'll be moderating today's session, and I'm excited to introduce our panelists today. Our panelists are coming to us from Arogya AI, their company. Avlokita Tiwari is the co-founder and CTO of Arogya AI. She has a Master's of Science in Bioinformatics from the University of Turku in Finland. Aniruddh Sharma holds a degree in Mechanical Engineering from IITRAM Ahmedabad. He has previously worked in robotics, deep learning, and computer vision. Now he is a data scientist at Arogya AI. I want to remind our panelists that all of our participants that questions should be posed through the neural network chat. At the end of the talk, I will moderate and ask those questions to our speakers. So thank you so much, everyone, for coming today, and I will turn the floor now over to our speakers.
Thank you so much, Anna. Hello, everyone. We are Arogya AI. We are a small company based out of India who are working on precision medicine for antimicrobial resistance. 23-year-old Sonu lost one lung, hearing in one ear, and all of his parents' life savings while going through a grueling regime of antibiotic trial and error to find the right combination of drugs that would cure him of drug-resistant tuberculosis that he was diagnosed with. He's a classic example of not being treated at the right time at the onset of a disease with the right medication due to a disease which is preventable and it could have been avoided. Experts believe that superbugs will cause the next pandemic. 1.6 million people died globally from tuberculosis in 2021. This is a preventable disease. It's a treatable disease. It has existed since the Egyptian mummies. The antibiotics have existed for several decades, and there is no reason why people should still be dying because of it. A lot of these deaths that have been attributed to tuberculosis also have the reasons in, for example, antimicrobial resistance itself. Because if we don't know the right combination to treat patients, deaths do happen. And this is a pattern which has been observed in even other infectious diseases like HIV, sepsis, and not just restricted to tuberculosis. TB, HIV, COVID, all these infections, they spread, especially the resistant pathogens, when they are spreading, they make the problem even worse. One of the things that we have seen, especially with the pandemic, were the multiple lockdowns that happened because of different variants that kept cropping up because of the pathogens evolution. As you might have heard very recently, China went into yet another lockdown because of a new variant that was found there. And again, one of the things that this is what leads to also the reemergence of diseases, where you feel like you may have eliminated the pathogen, but of course it's still there, it's still mutating, and it's still spreading and leading to the next pandemic. And there are patterns and statistics behind this that's scientists that a lot of people have been seeing for years and working on. And there were several warnings that a pandemic might be coming. And so how can we prevent the next one? How can we be prepared for the next pandemic? And one of the things that we truly believe is to predict the future drug resistance patterns as well, especially if superbugs could be the reason why the next pandemic occurs. So who are we? A little bit about us. So Arogya AI was founded by Dr. Prapti Jaiswal, my co-founder, and me. Prapti has a background in molecular and microbiology. She has over 14 years of research experience. Her PhD was in TB vaccine development, and she found a vaccine candidate that is being tested right now. My background, I did my engineering in biotechnology, after which I was working with Prapti in the tuberculosis lab for a little while, where even back then we used to talk about how can we translate what we are studying into a real world application. I then went on to do a master's in bioinformatics from University of Turku, Finland, after which I was working in antimicrobial resistance through ADP ribosylation pathways and using molecular biology and bioinformatics, looking for possible drug candidates for pertussis infection, which kills hundreds of thousands of infants every year. And again, after that, when I was talking to Prapti, after I had done my research, after I had finished my master's, we discussed that Prapti said to me that, hey, I finished my PhD. We have talked so much about how we can actually translate what we have studied and what is our background into a real world application. I want to start this company. Do you want to do this with me? And it sounded like a great proposition, which is how we founded Arogya AI in 2019 to begin with. And one of the first things that we had to think about was what would be our first step. And tuberculosis was the obvious choice because we both had our backgrounds in it. It is one of the biggest problems in India where we started the company. And then we got invested in by Illumina, which is the largest sequencing hardware company in the world, and a lot of support from the government of India as well, which is how we reached here. And before I go on, I would let my colleague also introduce himself.
Thanks, Avlokita. Hello, everyone. My name is Aniruddh Sharma, and I am the data scientist as well as leading the product development in Arogya AI Innovations. I have 2 years of experience in machine learning, software development, and DevOps role in the organization. During my graduation, I was more initially into robotics and AI related projects, as they were also a part of my course in mechanical branch. And I always enjoyed taking part in competitions related to robotics, where as a part of a 4-member team in college days, we actually designed and 3D printed a prosthetic arm in robots using fuel deposition modeling, which functions and move as per the responses through ECG sensor signals from injured person. So this project was selected, and we actually won the competition with a proof of concept funding of $600 from the organizers. That point, I got to know that there are so many opportunities and things which needed to be done to transform healthcare sector with different technologies. This spark made me to do volunteer work for a year in an NGO. It was an organization of Spain, Peter Moss Leukemia AI Research, which was using robotics, AI, and IoT to battle leukemia and improve healthcare industry. So I got interested and have this thing in my mind so that I will try to take opportunity and start my career in digital healthcare, which need to transform the current methods to make impact in medical industry. And that's how I got to know about Arogya AI and joined them to make a disease-free world. Thanks.
Thanks, Aniruddh. So one of the things that we've been working on at Arogya AI is to make something that can give the right antibiotic combination from the get-go, because that is what will lead to lessening the antimicrobial resistance that keeps cropping up. And the idea being that if a patient is diagnosed with a disease, say for example tuberculosis, the specimen of the patient is immediately sequenced. It can be run through a software that can give the correct drug susceptibility report for that particular patient to take to their doctor, and then take the right combination of medication. To build this software, the Arogya AI's AI Care software, what we did was train the algorithm on 7,000 whole genome sequences. We did validation on 10,000 whole genome sequences. And right now we are doing a prospective validation at the All India Institute of Medical Sciences in India, one of the biggest public hospitals that there is. And for a disease like tuberculosis, a particular immediate value add was also that this solution would be 100 times faster than what is the existing gold standard, which involves doing a liquid culture that can take several weeks for the results to be gotten for a combination of like 19 antibiotics that exist for tuberculosis. And that was the idea, to have as much comprehensive view of the situation as possible. And so for the AI Care that we built a platform that has a feature of a continuous learning feedback loop. The idea being that you look at a genomic database, you are able to identify patterns, statistics, new mutations, not just what is already known, but also look at these novel mutations, do genetic correlation through in silico and in vitro validation. And that can be fed back into this algorithm to relearn it again. And this learning doesn't have to be restricted to just genomics. It can be expanded also and added into with transcriptomics, proteomics, have structural components, basically look at a holistic systems approach when it comes to learning, relearning, and therefore being able to do even diagnosis on the ground. And this entire platform is inspired by evolution itself, because we have seen the way pathogens evolve and keep spreading. So the central theme of what we truly believe is that continuous learning is the only approach for staying ahead of the bugs. And although this is a platform, AI for Good, where we're talking about how AI can help do this, this is not restricted just to what artificial intelligence can do for this, but also, for example, we have just seen a pandemic. What have we learned from it, whether it comes to spreading of misinformation or various aspects of how policies were developed to handle the pandemic in the first place? All of those learnings need to be fed back again into, it has to be a continuous learning loop, so that moving forward, we can actually prevent the next pandemic. I give the floor to my colleague again to describe a little bit more about the AI aspects of what we have developed. Aniruddh, over to you.
Thanks, Avlokita. So let's go a step back and see how the current diagnosis methods are only focusing on the flagged in literature, where to check resistance status of a drug, or DST, which is a document that provides the information about the susceptibility of a particular strain of pathogen to a set of drugs. The observer only looks for specific locations, if you can see on the left section. So those specific locations, which it can be either set of genes, SNP, or analyzing a targeted sequence sample, which clearly misses out the concept of potential and novel location where pathogen is evolving itself to become resistant to the drug. And that is where we need to change our approach. As Avlokita told her earlier, that the continuous learning only take a look on, not only take a look on analysis perspective, over the whole genome, but also monitor and analyze the variants with the interaction of their associated drug. This kind of input data can be complex as well as difficult to make a classification about how the pathogen will interact with the drug. This is where we use this data with machine learning to find all important features which are deciding and responsible for giving the associated status. This approach have multiple benefits. One, analyzing and decision making through whole genome pathogen. Two, finding new mutations or those who have a potential in future that can cause drug resistance. Three, it gives more faster, precise, and accurate data-driven results than literature findings. Now let's move to the next slide. Till now, we saw how can a model predict and identify drug resistance status for a sample of a pathogen. But what about how any pathogen have evolved during the course of time as well as made itself to have the ability to become antimicrobial resistance, which basically refers to the ability of pathogen such as bacteria, viruses, fungi, or any parasite to withstand the effects of drugs such as antibiotics, antivirals, and antifungals that are commonly used to treat infection. This means that the microorganisms can continue to grow and multiply even in the presence of these drugs. It makes difficult to treat the infectious disease that they cause. And this is where we create a phylogenetic tree. So a phylogenetic tree is a diagram that shows the evolutionary relationship among different strains or subtypes of the pathogen. The tree is constructed by comparing the genetic characteristics of the different strains and grouping them based on their similarities. The branches of the tree represent the different strain of the pathogen. This tree can be used to study the evolution of the pathogen and the relationships among basically new emerging strain based on their positions on the tree. Now, the ongoing approach to create this phylo tree for pathogen is limited with the availability of associated lineages and sublineages detected so far at present. But this method clearly misses one of the point of this tree, which is looking for new emerging variants, which can cause possible divergence by predicting the pattern of evolving new variants, which is possible using an unsupervised machine learning method, which you can see on the current screen, where we create a phylogenetic tree using unsupervised machine learning and find new variants that are causing divergence, which are not classified or even studied or not even listed out in literature so far. So if you see in the first diagram, the algorithm is using the variant data for all recorded samples for a specific pathogen, like here it is bacteria. It trains the model which identify patterns that indicate evolutionary relationships between different samples. Now, if we add samples which we know that it have new variants and which are not used previously during training of the model, it will create and clearly highlight a possible divergence to make a point of potential emerging mutations in this tree. That are so those emerging strains may not be addressed or observed so far. This approach is also more than 10 times faster than current bioinformatics pipeline, which are used to create the phylogenetic tree for a particular pathogen. So again, let's move to the next slide and see if this approach can really give the desired output. So what we really did, we basically tried to evaluate the performance of this approach. We created a phylogenetic tree for MTB samples using more than 6,000 samples for MTB complex. And the model was able to actually cluster into these sublineages and lineages. The accuracy for each cluster is calculated if the output label of a sample in cluster is matching with the reference, where we used public lineage database of MTB samples from literature. The number of samples for sublineage used in validation were as per the availability of data which we got from public sources. Now, if we see the accuracy for lineage 4.1 and 4.3, which is around between 70 to 80%, it is because of possible new divergence that can be happening. And for those sample in cluster, that shows the possibility of further study and publish those potential divergence which need to be addressed and done. So this is the benefit or the impact which this kind of approach can have to monitor these new bugs which can cause future drug resistance. That's all. Thank you.
Thanks, Aniruddh. And so keeping those things in mind, to have an approach that can be as robust and as agnostic to situations as possible, especially if you think about patients that might be based out of really remote places where you only have clinics that may or may not be able to have a setup of a full sequencing device, but rather cheaper sequencing devices. The idea was to make the platform as agnostic on our end as possible, so that if there is a sample, it doesn't matter what the sequencing machine is. We can actually process data from any of the sequencing standard machines that are out there, and be able to identify right from get-go if there are bacteria, fungus, viruses, what are the species that are infecting this particular patient, as well as then be able to give them the drug susceptibility report. The AMR detection can be done in all of those patient specimens as well. And so basically, to come to what the whole conclusion of this talk is, which is that pathogens evolve constantly. It's a survival instinct. They spread through populations, evolving, figuring out ways to stay infectious, again, as we have seen through the pandemic, through COVID-19. And the whole idea behind this is their instinct of survival, that they spread like that and therefore keep themselves alive. They can go from a petri dish to a full-blown pandemic in a matter of weeks, again, as we have already seen that. And so what we can do is use artificial intelligence, which can predict their evolution. We can use artificial intelligence to keep them in check from rising and spreading, and therefore we can use artificial intelligence to help prevent the next pandemic. And this is something that we feel very passionately about at Arogya AI, and I would like to take a moment to thank my entire team, which consists of scientists, bioinformaticians, data scientists, people from operations, all of them working towards this common goal. Because of this pandemic, we actually were working together for 3 years, but we never got a chance to meet till this November, when we finally went on a jungle safari in India and got to meet each other. We did a lot of brainstorming about various ways to approach this vision that we have, and basically how we can, work towards a disease-free world. And I would request everyone that we are constantly looking for collaborators. There's a lot of work that goes on in silos all across the world, but working together, working towards the AMR stewardship is the only way to actually be able to prevent the next pandemic. And therefore, we are always looking for people to work with, collaborators, people who need, a data processing or basically anything. Please feel free to reach out to us. This is our website and our contact address. And thank you so much, AI for Good, for giving us this opportunity to present what we have been doing at Arogya AI today at this platform. Anna, over to you.
Great. Thank you guys so much for your talk and for introducing that really important and interesting problem. So far, I'm not seeing any questions that have come in, but as we wait for them, I guess I will take the moderator's privilege of asking my questions first. So I've been doing research on tuberculosis genomics in the United States for about 3 years now. And I think one of the big challenges here in the United States is securing funding prior to the COVID-19 pandemic for infectious disease research in general, but still for tuberculosis specifically, because it's not as much of a pressing health concern here. So I was wondering if you could speak sort of broadly about what your experience has been like trying to secure funding. Is it an entirely different scenario in India, or do you face some of the same challenges, and how have you overcome those?
Sure. I'm unable to unmute my video, just a small point there. So yeah, initially when we had started the company in 2019, there was definitely some resistance about funding where it comes to health tech and especially infectious diseases. But I think one of the things that the pandemic did was start the conversation in all communities with all backgrounds about, what is going on, how are infections spreading, and that gave quite the conversation completely changed. It became more about, hey, what can we do? How can we prevent this? What can we do to, make sure this doesn't happen again? And I think that helped more than anything else in the conversations, and especially the funding bit of, having the startup that is working towards this. I hope that answers your question, Anna.
Yeah, thank you. I think it's been maybe a tiny silver lining of the pandemic that, the infectious diseases have come to the forefront of the conversation again. Mm-hmm. A second question I was going to ask was, so I think there's perhaps a balance between looking at new pathogens that might evolve from new zoonotic events, kind of the way COVID-19 was thought to pass to humans from bats, versus looking at pathogens that we already know about that are circulating in the human population that might evolve mutations that make them more resistant or more transmissible. Have you thought about sort of the zoonosis route to the next pandemic, or are you focused on just the mutations and pathogens we already are surveilling?
Ideally, if we had all the resources in the world, definitely that. Mm-hmm. But as a small startup, our, of course, focus has been on dealing with the ones that we already know of. We know that a lot of research is also happening on finding new zoonotic pathogens, which is why also I mentioned that we're happy to collaborate and work with them. Mm-hmm. Again, being a tiny company, we can't do everything, but we would love to be a part of those studies as well, because it's just so interesting. And again, the systems-based holistic approach being the idea here. Mm-hmm.
Mm-hmm. Absolutely. Great. So I guess if I can ask you the tuberculosis specific question that I always get. So tuberculosis, as you know, and as you presented, has many different lineages that tend to be found in different areas of the world. But I know India has, I believe, all of those lineages in circulation. Have you found that you need to develop different approaches for the different sublineages, or are you able to develop approaches that can accurately diagnose resistance across lineages?
So that is exactly what we are doing with prospective clients right now, is study if we can do it across different lineages just as accurately, because the training data that we have used so far is of a global level and not just the Indian level. Mm-hmm. But we definitely feel, especially looking at the AI models that we've been dealing with, that there is a possibility that the divergence might be a little bit different based on the countries as well, especially in a population like India, where the spread is so much higher. And I mean, we have 1/3 of the TB global TB burden. So we definitely believe that, and that is a step that we are taking in order to be able to do that.
Yeah, absolutely. I think it's an interesting point to study that we know that certain lineages seem to have higher intrinsic rates of drug resistance, or maybe evolve drug resistance more quickly, but then certain mutations like in RNA polymerase confer resistance across all lineages. So I'm always curious about how much of a balance there is there with the approaches. Yeah. Have you found that you're able to get samples that sort of accurately recapitulate the populations that you're studying? One of the challenges we face in my lab is that most of the samples we have that are publicly available are from lineage 4, the European lineage. And I think that makes up 60% of our samples, but not 60% of the global cases. So
Exactly. And that is something I think that even Aniruddh alluded to a little bit, that when it comes to lineages, you will find that they're there, especially in the databases. So there is like the literature bias that is present, but not the population actual, how it is on the ground. And again, one of the reasons why prospective validation is just as important, that we go as we collect and therefore are able to actually sequence as much as possible and add to the other lineages as well.
yeah, I think that's fascinating. Yeah, I don't know how much you're able to say about the specifics of what you find in the technologies, but I'm curious, you talked about the kind of tension between having an existing list of mutations that you know confer antibiotic resistance versus having to develop methods to constantly be annotating new mutations that might be conferring resistance. For say 100 samples that you collect, how many of those samples actually have new mutations or unexplained antibiotic resistance versus how many kind of have the tried and true known mutations?
Not delving into too much detail, in about
Sure.
17,000 whole genome sequences, we found at least 12 new mutations that look a little significant, and we have not found them across any catalogs. So it not be statistically a huge number, but if you think about how they spread and exactly, evolve, I feel like any information is good enough to validate and feed back into the algorithm.
Yeah, absolutely. And there's probably a long tail of very rare mutations that we have not observed yet that could be giving resistance. So I think it's very interesting to try to prospectively model those things.
Which is also one of the reasons why we always bend more towards the whole genome sequencing as a whole, because we feel there is a lot more information there that can be gleaned by looking at the entire genome, rather than the quicker and, of course, cheaper method, which is the targeted sequencing.
Yeah, absolutely. I'm in agreement with that approach. I published a paper last year or at the beginning of this year, where we used a convolutional neural network to try to predict resistance. We only looked at 18 different whole genes in the genome. And for certain drugs, we found that there was unexplained resistance in our data set, that essentially they were genetically identical to sensitive strains at the loci we were looking at, but they were phenotypically resistant. So I think, looking at the entire genome and previously unsequenced or ignored regions is really important.
As well as the drug-protein interactions that, again, Aniruddh talked about, because there are structural components when you look at the pocket itself. It may not be that particular mutation, but other interactions as well that could be feeding into this.
Yeah, absolutely. So I, again, just want to remind any participants out there, if you have a question you want asked, please post it in the chat on the AI for Good website, the neural network. If not, I can continue asking questions of our speakers, but we'd love to hear from you as well. So do you have plans to work on any diseases other than tuberculosis, or do you think that will take up your time for the foreseeable future?
No, absolutely. Our tuberculosis product is the most advanced one, ready for deployment, but we have been working on some fungus and viruses as well. So most definitely plan to expand into all infectious pathogens, and it's just happening one pathogen at a time in our backend.
Absolutely. Great. Well, if there are no further questions, so I think we may go ahead and wrap up, but we'll be hanging around for the networking session on the neural network for the next half hour or so. So please feel free to ask questions of us there, or I'm sure, I'd be happy to answer questions by email, and I'm sure our speakers have given their contact information as well.
Absolutely. Thank you so much.
Yeah, thank you so much for speaking. And thank you to all the participants out there. So have a great rest of your day. Bye.
Bye. Thanks.
Thank you for participating in today's AI for Good session. We hope you've learned something new, innovative, and engaging in today's event. We now encourage you to continue the conversation on the live video wall in the neural network. Here you can ask questions, like and comment, share links, complete the poll, connect with interesting profiles, or speak one-on-one using the chat and video function. We invite you to explore the lobby, try the smart matching quiz, visit the virtual exhibits, poster boards, the eShop, and build your personalized AI for Good program. Let's shape the future of AI for Good.